Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
In this video, I will explain how to study systemic microbiology, only way. Begin by building a systems map that links organs, microbes, and symptoms so you learn relationships, not facts in isolation. Focus on patterns like transmission route and tissue tropism while annotating immune responses and diagnostic tests. This approach reduces rote memorization, speeds recall during exams, and makes clinical reasoning intuitive and dependable for real patients. Use active study methods that mimic clinical thinking to master systemic microbiology. Solve case questions and force yourself to justify why a pathogen targets a system and which tests confirm it. Make flashcards with clinical stems and teach peers one system each week to strengthen connections. Spaced repetition and mixed practice make recall fast and durable, helping you apply knowledge under pressure in exams and clinical rotations. If you are finding this video helpful, please subscribe and like to support more study tips. Quick recommendation: I use leak-proof meal prep containers to keep lunches neat between study blocks and avoid spills on notes. They save time and stress. Check the description for the link and other deals to grab a set for yourself. Thanks for the support, and now let's get back to the video. Prioritize understanding diagnostic tests and treatments as part of system-based study. Memorize when to use PCR versus culture and what each result implies for management. Learn first-line therapies, key drug classes, typical dosages, and major resistance concerns so treatment decisions become automatic. Always connect lab findings to the clinical timeline to anticipate complications, choose follow-up tests, and explain choices clearly to colleagues or examiners.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.